When it comes to dental health, many people tend to focus on the importance of brushing and flossing regularly, attending regular dental checkups, and maintaining good oral hygiene habits. However, there are instances where more extensive dental work may be necessary in order to restore the health and appearance of your smile. One such procedure that may be recommended by your dentist is the creation of dental bridges. Dental bridges are a type of dental prosthesis that are used to replace missing teeth. They are typically made up of two or more dental crowns that are attached to natural teeth or dental implants on either side of the gap where the missing tooth or teeth used to be. The false tooth or teeth are then attached to the crowns, creating a seamless and natural-looking smile. There are several different types of dental bridges that your dentist may recommend, depending on your specific needs and the condition of your teeth. The most common type is a traditional dental bridge, which involves creating a crown for the teeth on either side of the gap and attaching the false tooth in between. Another option is a cantilever bridge, which is used when there is only one natural tooth next to the gap. Maryland bridges are another option, which involve attaching the false tooth to a metal or porcelain framework that is bonded to the adjacent teeth. No matter which type of dental bridge is recommended for you, the process of creating and installing them is generally the same. First, your dentist will take impressions of your teeth and the gap where the missing tooth or teeth are. These impressions are then sent to a dental laboratory, where the bridge will be custom-made to fit your mouth perfectly. In the meantime, your dentist may provide you with a temporary bridge to wear. Once the permanent bridge is ready, your dentist will schedule a follow-up appointment to have it installed. They will first check the fit of the bridge and make any necessary adjustments to ensure that it is comfortable and looks natural in your mouth. Once you and your dentist are both satisfied with the fit and appearance of the bridge, it will be permanently cemented in place. One of the main benefits of dental bridges is that they can help improve the appearance of your smile by filling in gaps left by missing teeth. This can not only boost your confidence and self-esteem, but can also help prevent other oral health issues, such as shifting of the surrounding teeth and difficulty chewing or speaking. Additionally, dental bridges are a durable and long-lasting solution for missing teeth, with proper care and maintenance. In order to ensure the longevity of your dental bridge, it is important to practice good oral hygiene habits, such as brushing and flossing regularly and attending regular dental checkups. Your dentist may also recommend using a special floss threader or water flosser to clean around the bridge and keep it free from plaque and bacteria. Avoiding hard or sticky foods can also help prevent damage to the bridge and surrounding teeth. Overall, dental bridges are a valuable option for restoring missing teeth and creating a seamless and natural-looking smile. If you are missing one or more teeth and are considering dental bridges as a treatment option, be sure to talk to your dentist about the benefits, risks, and cost associated with the procedure. With the right care and maintenance, dental bridges can help enhance your smile and improve your overall oral health for years to come.